So I'm going to present you today some updates on the COVID-19 response mechanism, so C19RM, especially with a deep dive on the civil society and communities and the role and the eligible interventions. So on the next slide, please. On the overview slide, on slide 2, this is just to remind all of us that we have received 3.5 billion US dollars from the United States government, as well as 140 million euros from Germany. So in total, we have approximately 3.7 billion US dollars to respond to COVID-19 and also to mitigate the impact of COVID-19 on HIV, TB, and malaria programs. Next slide, please. So what is new for the C19RM 2021 edition? What is new is that the CCMs and the regional mechanisms have received allocation letters. Approximately, I think 2 weeks ago, most of your CCMs should have received an allocation letter with a base allocation and an above base allocation. There is also this time the possibility to submit a fast track funding request. I will come back a little bit more into the details of that. And the funding request will need to be submitted according to a scheduled submission windows. This is not new, but CCM are required to engage communities throughout the process. And what is new is that there is a need also to engage with the national COVID-19 response bodies in the country. Next slide, please. So who is eligible? All the current implementers, countries or regional multi-country recipients that are receiving funding from the Global Fund. All of them are eligible and should have received already the allocation letter. Next slide, please. This is the slide 5. So on the eligible investments, just to note that like last year, 2020, there are 3 main interventions category for C19RM. The first one is the pure COVID-19 response. The second one is all the interventions to adapt programs to fight HIV, TB, and malaria. And the last one is strengthening health and community systems. What I want to emphasize here is that community-led responses, community responses should be found across all the interventions and not only in the last bucket, the last intervention around community systems and health systems, because communities have their role to play also in pure COVID-19 response, for example, and I will give some example later. Just to note on this slide that C19RM will not support the procurement of vaccine. Why? Because procurement of vaccine will be supported by Gavi and COVAX mostly and the World Bank. But some interventions around vaccine will be eligible, for example, the use of community-led organizations to work on vaccine hesitancy could be a possibility. Next slide, please. So on this slide, this is the 10 pillars of the WHO COVID-19 response framework. So this is just to highlight that the C19RM 2021 from the Global Fund can finance any of the pillars from WHO to respond to COVID-19, except the pillar number 4, which is for the ports of entry, international travel, and transport category. And again, to highlight that the community responses should be found across all the pillars and not only in the pillar number 2 of WHO, which is on community engagement. Community responses should be found everywhere. Next slide, please. So your CCMs have received the allocation letters and the allocation amounts. So, to make it very simple, we are expecting each country to submit 30%, a request of 30%, 30% of their 2022 HIV, TB, and malaria allocation. There is 15%, which is called the base allocation, and another 15%, which is called the above base allocation. But the total is 30%. So this is what we anticipate to be able to support per country. On the next slide, this is just to highlight that there will be 2 ways of submitting. There is the submission windows for all the supported activities, and there is the fast track funding request, which I'm going to describe now in the next slide. So if you see this slide on the fast track funding request, so all the countries who have received an allocation letter and the regional grants can submit a portion of their base allocation for urgent procurement of commodities. So PPE, masks, for example, diagnostic, of course, for COVID-19, rapid diagnostic, and also therapeutics for COVID-19, like oxygen and related equipment. This can be submitted at any point in time from the date of the allocation letter. It does not need to follow any calendar, any window calendar. Countries can decide to submit anytime. On the next slide, this is to show you the submission windows and the timelines. So like I said, the fast track is at any point in time since 7 or 8 of April when the allocation letters were sent to the countries. And then we have 4 windows. The first one is on the 14th of May, and then every 15 days until the end of June for the window 4. It's important to submit before window 4, otherwise the funding for the country might be lost. On the next slide, please, is just to illustrate the timeline where we are. So now today we are in April. We are having these webinars thanks to the CRG Strategic Initiative, regional platforms, and also the key and vulnerable population networks. We will have then the fast track submissions, which have started. We already received 1 or 2 fast track submissions from countries. We have the 4 windows that I just mentioned between mid-May and end of June, every 15 days. And then what is important to note is that the deadline to use the funds is the 31st of December, 2023. I want to insist here on when you are going to the CCM for the discussions. It's anticipated that most of the funds will be used way before December 2023 because we are in an emergency mechanism. So we are supposed to respond to emergency challenges and needs. So you understand that most of the activities should be time-bound and should be really implemented as early as possible. So the deadline is December 2023, but we anticipate that most of the funds will be used before that. On the next slide, please. Implementation arrangements. I wanted to re-emphasize this because you will find in the guidelines, in the information notes of C19RM, some language around implementation arrangements. But what I wanted to say here is that we anticipate that the principal recipients for your HIV, TB, and malaria programs today are going to be the principal recipients for the C19 RM funds in 2021. So we are using the same PRs and the same grants. Honestly, is really just for to be able to be agile and fast. You know that to have a new principal recipient requires a lot of work, a lot of time, the capacity assessment of the principal recipient, and so forth and so on. And so, since we are responding to an emergency, we want to act quickly. What I wanted to say, though, is that even if the principal recipients and most of the time the sub-recipients are going to remain the same, there is the possibility to include new sub-recipients, for example. This is easier in the global fund processes to include a sub-recipient. And also maybe to contract new implementers, maybe with just a service provider contract. I will get back to that a bit later. On the next slide, please. So community engagement is key and remains key for the Global Fund. And when we talk about community engagement, we are talking about a meaningful engagement, not only the ticking the box exercise to sign off on the request and not being engaged. We are really talking about a meaningful engagement. This is a requirement from the board members. This has been a very strong message from the board. After analyzing 2020, they said you need to do better in 2021. So we've tried to do a lot of things to try to improve community engagement in 2021. Just before I'm getting to the details of how we can do that, I just wanted to highlight as well that this time around, we need to include communities most severely affected by COVID-19. So we are talking about, of course, our usual, key and vulnerable populations for HIV, TB, and malaria, with whom we engage on a regular basis. And of course, are represented at the CCMs, but also this time around for the COVID-19 response mechanism 2021, we need to include communities most severely affected by COVID-19. On the next slide, please. So how are we going to improve community engagement? Well, first, looking at the past. So we've conducted a survey last year in September, October 2020, around the C19 RM last year. And we sent this survey to the civil society, and in particular civil society CCM members. So the majority of you, 76%, you told us we had received timely and relevant information, which also concurs with one of the presentations we had earlier today, which was saying the same, that information was shared around C19RM and the people felt informed. However, 76% is fine. And this is a global, I'm not talking about LAC here, this is like a global survey. So LAC was actually the highest number of respondents, but this is a global result. But we should aim for 100%, you know. When you are in a CCM, 100% should have told us, yes, we had the relevant information. What there is, where there is clearly an opportunity to improve is on the broader constituency information, because you can see on this graph that only 35% of the non-CCM civil society told us that they had received information. Next slide, please. While, yes, this slide. So while there was a high level of involvement, 70% of you told us, yes, we were somehow involved in the process of C19RM last year. That's good. But only 14% and 15% of you told us that you were involved in the costing, the budgeting, and in the writing of the funding request. And so we know that if you are not there when the CCM is working on the writing, basically, you know, your input can be lost. So one of the lessons learned is really to maintain the engagement until the proposal writing and budgeting. And I will try to highlight some of the ways to do that. Next slide, please. Yes. Many respondents also told us, actually 32% of the current CCM members told us that they haven't seen, no, I think it's the previous slide, sorry. Can you go to the previous slide? Yes, this one. 32% of the respondents told us that you haven't seen the final draft before it was sent to the Global Fund, which is really worrying, because as a CCM member, you sign off on the request. This is a requirement for C19RM. So we would expect 100% of the CCM members to have seen the final request. And it was not the case. 32% said they haven't seen it. So clearly we need to improve here and ensure informed signed off. And the key message here is please let us know when there is any engagement bottlenecks. Because if someone is not seeing the final funding request, it's probably reflecting some engagement bottlenecks in the process. So we need to be informed. Please inform your LAC, CRG regional platform, your key population networks, even the country team, of course, or the CRG department. Please inform us by any means, but we need to act quickly on these engagement bottlenecks. Next slide, please. So this is my last slide on the lessons learned from last year, where in the survey, 50% of the respondents said that their key priorities were not included in the funding request. So we need to support the prioritization discussions at CCM, and we are going to discuss maybe some ways of doing that. Just to highlight here in the survey that the words community, young people, key populations were associated with not included, no interest, or not prioritized. So clearly we need to do some work here on supporting this prioritization. So how are we going to do that? Next slide, please. So this slide is giving you a snapshot of how the Community Rights and Gender Department of the Global Fund, the strategic initiative, through the TA providers, technical assistance providers, the key and vulnerable population networks, and the CRG regional platform, are going to support this community engagement. First, the short-term technical assistance. What is very important in our opinion, and also from what we've heard in the consultation with you last year, is to do this situational analysis and the need assessment so that you can come to the CCM table with the evidence of the impact and why you are asking activity A, B, C, or D to be included in the funding request. The second short technical assistance is around virtual and face-to-face community consultation to inform the priorities. Once we have done the situational analysis and the need assessment, we need to prioritize, to come together with one voice at the CCM and to come with prioritized list of activities for the C19 RM funding request. So please contact your CRG regional platform and also the CRG department email, which is mentioned here. If you want information, if you want support, if you already are ready to start the work and you need technical assistance. The key and vulnerable populations and networks and the CRG regional platforms are also going to help in different ways. They are going to, like they are doing today, to hold some regional webinars to share the guidance, to disseminate all the information, also to help at country level to convince civil society and community in-country consultations to identify these C19RM priorities. And also they are going to help with the feedback to the Global Fund Secretariat if you have engagement bottlenecks, like I mentioned earlier. So again, please contact your key and vulnerable population networks and the CRG platform focal points for all of this. Next slide, please. What we have also managed to get this year for 2021 is additional funding for the CCMs, because the CCMs play a very important role in this and in engaging communities. So we managed to get from the C19RM $3.7 billion fund, 25% additional funding for CCMs of their annual budget for 2021. So each CCM, and it's based on request, so please reach out to your CCM and tell them that this is a possibility, they need to take it, can ask for 25% of their 2021 annual funding to recruit somebody, whatever they want to use it. You know, if it's to have meetings, to organize consultations, analyzing whatever data, they can use it the way they want. But this is really to help you, key stakeholders and communities in particular, but also to include coordination with the national COVID-19 response bodies. Next slide, please. What we have also Yes, this slide. What we have also done this time around for 2021, you will see in the technical guidance documents, like the technical information notes, the HIV/TB and malaria information notes to mitigate the impact of COVID-19, in the template of the funding request, and so forth and so on, you will see a lot of emphasis on CRG, on community rights and gender, and on communities in particular, and on community responses. We actually also have for this year a technical information note on community systems and responses, which I'm going to detail in one slide or two slides. So I'm going to pass on that. Next slide, please. Yes, on the community systems and responses, we have tried, like I was saying, to make them more visible across all the documents. So I mentioned the template itself, the narrative funding request template. If you have already seen, you will see that there are 4, 5, or 6 sections now in the template where the CCMs will have no choice but to really reflect and analyze the service disruptions on key and vulnerable population programs, on the impact of COVID-19 in the country, on gender-based violence, and on human rights violations, and so forth and so on. So, you know, really, we have tried to make the community system and responses challenges more visible in the funding request template and all the documents. For example, in the modular framework and in the detailed budget, there are 6 CRG-related interventions out of 18 in total. So the four which are highlighted in green on your screen are the regular community system strengthening interventions. So it's community-led monitoring, community-led advocacy and research, social mobilization, and institutional capacity building. And there are 2 more specific interventions in the modular framework and the budget, which are gender-based violence prevention and care, and respond to human rights and gender-related barrier to services. However, these 6 interventions are very important and increase visibility, you know, for you to advocate to include these interventions in the request. But it's also important to, like I mentioned earlier, to highlight that community-led organizations and responses should be engaged in all other interventions, not only in the 6 here. They should be also maybe engaged in contact tracing of COVID-19 patients, in testing for COVID-19 in the community, or on vaccine hesitancy campaigns. You know, there are other examples. So please don't limit yourself to these 6 interventions here. Community systems and responses can be included everywhere. Next slide, please. So this is just a screenshot of the CRG guidance that I mentioned earlier, which is new. It's available on the website with all the other documents for C19RM. What we have tried to do in this document is to basically give you share some evidence of the impact of COVID-19 on GBV, on human rights, on key and vulnerable populations. So we collected some, of course, it's not exhaustive, but we've collected some evidence from the UN, from WHO, from UN Women, from UNFPA, from Stop TB Partnership, UNAIDS, on the evidence so that you can actually use this evidence to come to the CCM table and say that, what you are proposing is responding to the needs and the challenges of COVID-19. And also in this tool, we hope it can be a tool, is also to have like a list of very concrete examples, interventions, activities even, which are eligible. They are in line with our budgeting guidelines. They have been validated by legal at the Global Fund, by finance, by sourcing. So it's really interventions that are, okay, completely acceptable and eligible in the funding request for C19RM. And this is a document that is actually coming from the recommendation from civil society and communities, mostly. Next slide, please. I have just 4 slides more. So this slide is one of the categories of this tool, this guidance. The category is around support, giving the means to community-based organizations to continue to work. Just that, we know that CBOs need to continue to do their work, and for that they need PPE, for example. We've seen a lot of requests last year from governments, from countries, from CCMs to C19RM, but very often the PPE were actually not reaching or included, for the community-based organizations to continue to work. So it's very important that, for example, PPE is also for community-based organizations for them to continue to work. Next slide, please. On social protection and mental health, I think we've heard a lot today during the webinar on the need for nutritional support and other livelihood packages. You can see this is one of the items here, which is in the list of eligible activities, because we know that COVID-19 has magnified existing inequities, and especially key and vulnerable populations to continue to access prevention services and support and treatment need some form of social protection. However, I just want to emphasize that you will see in this document, in the Annex A, that there are some limitations. And I'm sure we all appreciate that the Global Fund cannot be seen as a nutrition program, even if with C19RM. There are other organizations, the World Food Program and others, who are specialized in this. We are not experts, and this is not our mandate. However, you will see in the Annex A some clear criteria for inclusion when you consider including nutritional or social support in your funding request. Please be mindful of these limitations. So one of them, for example, is that it needs to be linked to maintaining TB or HIV program delivery or access and outcomes. For example, for TB as an incentive for TB patients to be retained on treatment. It should be only a small proportion in terms of dollar amount of the overall request of the country. We cannot, agree to receive a funding request where the majority of the requests would be for nutritional support, for example. So there are some enrollment criteria. It should be defined. It should be most vulnerable populations with the most critical needs. It needs to be time bound. So you will see the list in the Annex A of this guidance, which will guide you if you decide to include, especially nutritional support, in the funding request. Next slide, please. This slide is just also to highlight that in this list of concrete examples, we have examples of community-led activities. This is because we have seen results from many UN institutions around the fact that financial and human resources have been diverted from government disease programs to the fight against COVID-19, which we all understand. So there is really an opportunity here, we think, at the CRG department to engage more communities and use this funding. This is a real opportunity, and we are talking about a lot of money per country, because communities are needed, more than ever, to provide some services in this pandemic. So, for example, here some activities include the fact that community-led monitoring could be, done for quality of services, stockouts, human rights violations. We need also to support the development of advocacy materials to preserve access to HIV, TB, and malaria services in the time of COVID. There is also the possibility to expand the provision of community-led HIV or malaria rapid testing to COVID-19, for example. So these are only examples to show that communities have really a role to play. And there is actually a question on that in the funding request template that the CCM need to answer. And the question is the role of CBOs, what is the role of CBOs in the response? So, the CCMs will have to respond to that. And my final slide, next slide, please. We have in this guidance, yes, thank you. We have in this guidance a specific section on gender-based violence and intimate partner violence, because of course we all know that worldwide there's been a dramatic increase in GBV and IPV, and not only in LAC, it's everywhere in the world. We have evidence here from UN Women, from WHO, among others. And here is just, a few examples of concretely what we could do. And I like the example of helping the existing helplines or hotlines, of GBV, for example. In most of the countries, there are existing expert hotlines who respond to the survivors and victims of GBV. And we know from experience last year that in some countries, thousands and thousands of calls of victims and survivors were not answered just because this existing structure didn't have enough phone or enough staff to respond. It would not cost a lot of money to just give them the means to respond to the calls. And it's important because the exposure to GBV is associated with increased risk of HIV acquisition and also linked with poor health outcomes for people living with HIV. So this is really, a very concrete example of what could be included in the funding request for C19RM. And with that, that's my last slide. So thank you very much, and happy to look. I'm looking forward to the discussion.